and then associate professor of systematic theology here in Serampore College. So now I invite Wanda to moderate the session. 92 people have come, so I'm sure 72 more people will join in a few minutes time. So Wanda.
Okay, can you hear me, sir?
Yes, I can hear you.
Okay.
No, we cannot hear you.
Can you hear me now?
Yeah.
Okay. So we are, I thank Dr. Wati for this opportunity to moderate this class. And tonight we have two teachers, very good teachers. One is Miss Amongla Jamir. She's the associate professor in the Department of Old Testament in Serampore College. And Miss Amongla is my best friend. She's my colleague. We were together doing our BD studies together at ETC, and after that, we worked together at John Roberts Theological College, and so we are together again at Serampore. So Dr. Amongla, she's also doing her DTH studies. She's writing her dissertation now, and hopefully she will submit very soon, and she will get the degree very soon. And we also have Mr. Sashi Imsong. He's the academic dean of Everest Theological Seminary, Kathmandu. So I request Mr. Sashi Imsong to introduce himself. I haven't met him, but I'm very fortunate to have the time with him together here in this class. So the topic for today is a pandemic, Christian faith and Bible. And Dr. Amongla will be focusing on HIV and AIDS, whereas Mr. Sashi Imsong will focus on children at risk. But before we start the class, before I give the time first to Amongla, shall we all look to God in prayer? Shall we pray? Lord God, we thank you that you promised to be with us always. As we gather together in this virtual platform, we invoke your presence in our midst. We pray that you would deepen our comprehension, broaden our thinking, and transform our understanding of what we are about to learn and study. Bless all of us, and especially bless our teachers, Ms. Among and Mr. Sashi. We thank you for being a good teacher, a counselor full of wisdom to all of us. We commit the rest of this time into your loving hands, and in Jesus' name we pray, amen. So at this time, I would like to invite Ms. Amongla first. Can you hear me?
Yes, I can hear you. Yeah.
Okay. Ms. Amongla, I give the time to you now, please.
Yeah, okay. I'm sharing my screen. Can you see the screen now?
Yes.
Okay. Yeah, we can see.
Yeah. Thank you, Dr. Wanda, for your words of introduction. And I want to thank Dr. Wati also for organizing this program and also giving me the opportunity to share and to take this class. I will just go straight away to the topic, and the topic is pandemic, Christian faith, and the Bible, HIV and AIDS. Now, HIV, this is a virus. This is a virus that attacks the immune system. And then AIDS, this is the symptom and the illness that is caused by the HIV virus. Now, although there are no cure for HIV, with the right treatment and support of people living with HIV and AIDS, one can enjoy long life and healthy lives. So the end of AIDS is the treatment of HIV. Now, pandemic, this refers to the global disease. And whereas I have not put here in the slide, but then epidemic refers to a disease that is prevalent in one specific region. Now, AIDS is one among many serious health challenges in the world. And HIV was first identified among the homosexual men and associated with the female sex workers. Now, let us see how HIV/AIDS is spread. Well, every one of us, we are aware of it and we know it, but this comes as a reminder for us. It spreads, or this is caused through the exchange of syringes or needles, then transfusion of blood, unsafe sex, different sexual behaviors, and women with HIV infections. This can also pass on to the babies, to the newborn during delivery or breastfeeding. Or the others also can be like sharp objects that have blood or bodily fluids with HIV. So that is how HIV is transmitted to different people. Now, people have different attitudes, where some consider the illness as a result of their sin and are rejected in the society, while some maintain that it is a part of reality, but still holds on to the idea of sin and thereby rejects. Though there are many NGOs and churches coming up to help people living with HIV and AIDS, yet there are many in the grassroots level yet to understand the problems. Churches often use the Bible for the purpose of exclusion, to oppress and stigmatize them. General judgments were made in many countries by the churches. Since the firm teaching of the church was to obtain from fidelity in marriage and premarital sex, it was falsely assumed that HIV infection was God's punishment because of disobedience to God's law, irrespective of how the disease was contracted. So that is how in the beginning many churches responded as punishment from God, which is similar to the plagues that is inflicted on the disobedient communities in the Old Testament. Even today, this theory is not completely eradicated from the church and the society as well. The conservatives, they still hold to the idea of punishment because of their sin and justify their rejection. People, they keep silent. People, they kept silent because of the stigma and the fear of rejection, which also contributes to the severity of the disease as a punishment from God. There are global commitments to ensure that everyone with AIDS should get HIV treatment. According to the UNAIDS 2020 statistics, there are 7.6 million people with HIV. Adults, 5.9 million, children, 1.9 million. New infections, 1.5 million, and this is a 30% decline since 2010. That is 1.3 million adults and then 160,000 children respectively. Approximately 84% know their HIV status, and 16% still needs to access testing services. So by the end of 2020, 27.4 million people could access antiretroviral therapy, that is ART in short. Now, global strategies on HIV prevention methods. The UNAIDS set a goal 2016 to 2021 strategy called as on fast track to end AIDS. 90 is to 90 for 2020 as its target. This means 90% should know their HIV status. 20% who knows their status would be on antiretroviral therapy, and 90% receiving ART viral suppression.
Join now. We'll get certificate.
2020, 4% pregnant women with HIV received ART to prevent transmitting HIV to their babies during pregnancy and childbirth. The death rate has decreased by 61% since 2004. So around 690,000 died of AIDS-related illness in 2020. That is a decrease by 61%. Next slide, effects of COVID-19 on people living with HIV and AIDS. With the spread of COVID-19 globally, it has a lot of devastating impact on individual communities, social sections across the world, such as job loss, food insecurity, inability to maintain medical conditions, and double stigma. These are some of the effects. Along with that, we will also see some more. Inability to maintain existing medical conditions, etc. And some of the most disadvantaged in the COVID-19 pandemic are people living with HIV and AIDS and chronic illness. The risk is also more significant for those that live in low and middle income countries, rural and poverty-stricken areas. Another additional concern for people living with HIV and AIDS is the double stigma, as I have said. That means if they are tested COVID-19 positive, then that is a double stigma for them. Maintaining a physical distancing is one of the ways to help in decreasing the new cases of COVID-19. But this has a lot of negative impact on the economy, thus affecting the marginalized communities, of which people living with HIV and AIDS cannot be denied. So the people living with HIV and AIDS are more vulnerable during the COVID pandemic, especially those who are not on ART or their disease is not well managed. They may have a greater risk for contracting COVID-19 due to their weak immune system. Not only that, but some of the major effects are interruptions due to restrictions on non-emergency medical appointments related to physical distancing. Health providers offer telehealth services, which all may not be able to get their opportunities because some of them, they may not have access to the different devices, the internet services, and this hinders their treatment. Healthcare facilities are open for COVID patients. So in the meantime, people living with HIV and AIDS face the risk of exposing to COVID-19 while attending to medical appointments. Migrant workers, majority of them are affected. Many of them are affected with HIV and AIDS. And since they are asked to stay at home because of the homestay orders, their treatments may be interrupted. People living with HIV and AIDS are 2 to 4 times likely to develop depression than those without the virus. Depression is one of the most common disorders among people living with HIV and AIDS, and that is around 40 to 42% suffer from depression. Physical distancing to combat COVID-19 may increase loneliness that can increase in depression symptoms. And this develops loss of interest, feeling of worthlessness, thoughts of death and suicide that may have negative effects or negative impacts on the people living with HIV and AIDS. And that leads them to neglect the desire to take medication or engage in the activities that are conducive to their health. Thus, it becomes important to these challenges and barriers to be addressed so that people living with HIV and AIDS can maintain continuity of care for their social and mental support system. Next is the effects of stigma and discrimination. Stigma. This refers to something that is designed to expose the moral status of a person and thereby even changes the person's social identity. Stigma, this makes one tainted. Stigma and social labeling, these are the two most denigrating norms of a society. So this is how people living with HIV and AIDS experiences more social challenges than their physical support. As a result, stigmatizing the disease contributes in complicating the treatment and management of chronic illness. People with chronic illness are more likely to suffer from depression, as I said earlier. The comorbidity of illness and psychological disruptions make clear that illness in the physical body affects the sufferer's existence in all aspects. Society's reaction to the illness shows that illness is a combination of physical reality and social response. Once a person is diagnosed with AIDS, it dramatically changes not the behavior of the sick, but even the response of the society. The labeling and societal attitude has adverse effects on the sick person. Along with that, silence is the fear of stigma that makes people not to reveal that they are HIV positive. People who are not part of the stigmatized group, they consider themselves as having a risk-free life. So it leads to rejection because of wrong information, misconceptions, and so on. And one of the misconceptions is also that just by touching the disease, it can be transmitted to another person. And these kind of misconceptions, wrong informations, leads the HIV patients, people living with HIV and AIDS, to be rejected and stigmatized. Internalized stigma. This is the negative ideas and thoughts that lead to feelings of shame, fear, and isolation. Stigma of labeling become determining factors for discrimination and isolation. It results in social exclusion and denial of social support, education, and not only this, but they are deprived in contributing to the welfare of the society. But one thing that we need to know is that HIV does not discriminate anyone. It does not know whether you are rich, whether you are poor, young, adult, male, female, and so on. But it affects anyone, any class of people in any society. But it is we who discriminate and stigmatize the people who are living with HIV and AIDS. Next slide. Biblical response to HIV and AIDS. People living with HIV and AIDS are condemned and stigmatized by linking the disease and sin. They suffer because of their sin. That is how many people link the disease. Hence, the commitment of love, compassion, and justice is lost. So the question is, as Christians, are we really practicing what we preach? Or are we making barriers rather than drawing closer to other children of God? There seems to be a contradiction to what we preach and experience in life. Although the Bible is the foundation for Christian faith and witness, there is no direct address to the issue of HIV and AIDS because it do not exist then. But the silence cannot be used to justify. Rather, we need to see how the Bible ought to be interpreted and applied to the different social issues. Bible speaks a lot about sickness and illness. And in such a context, how can we address the issue of HIV and AIDS from a biblical perspective? And how do we fit AIDS into our understanding of God's goodness and grace? Many seminars have been held, numbers of articles and books are published, and educations are given in through different platforms to break the silence, and also the theology of punishment. But are we still equalizing the sickness to wrongdoings? Or we preach about God's love and compassion for all? The Hebrew Bible believes that Yahweh is the of everything, and therefore is responsible for illness and disease. In many cases, disease and sickness are described as the divine punishment. For example, Numbers chapter 12. This talks about the issue of challenging the leadership of Moses by Miriam and Aaron. But we see only Miriam is punished. The affliction on Miriam and becoming a leper is considered as the consequences of sin. And we know the story there. She was isolated from the others because she would contaminate others who came in contact with her. I will not discuss why only Miriam is struck with leprosy and put into isolation, but what is important for us is that she experienced discrimination and oppression. She faced the stigma and suffering. Even though she was healed, the stigma remained as the one who sinned and was punished by God. She was silenced with her sickness, and this represents the silence and the voicelessness of the stigmatized individuals. At times, these kind of passages are used to justify stigmatization and suffering as the result of sin without even considering whether Miriam did really commit a sin or why only she is punished. In the same way, people affected with HIV and AIDS, no matter how they have contracted the virus and disease, they have been generalized like Miriam, suppressed, stigmatized, and their pains are ignored and silent. So the message here highlights several issues: that it is God who inflicts the disease upon Miriam as punishment, and the same God restores the health of Miriam. The text also highlights the pain and stigmatization, which is also the experience of people infected with HIV and AIDS. In the interest of some people, Bible was used to promote stigma, discrimination, and oppress the people. For example, in 2 Samuel chapter 13 and 14, the story of Tamar. This was misused to promote stigma, although it provides an empowering message in the context of HIV and AIDS. Another example can be on the model of Jesus' compassion. For example, in Matthew chapter 5, verse 21 to 43, the story of resistance. Jesus heals the bleeding woman and calls the daughter of Jairus from death to life. These are the two stories that we see there in Mark chapter 5. Now, reading the story against the background of patriarchy and Roman Empire, and against today's context of gender inequalities, racial discrimination, and HIV and AIDS, the story is understood to be a story of resistance, where Jesus appears as the liberator and also the healer. So one who restores hope and life in the midst of despair and death. Discrimination and stigmatization, this should be seen or understood as sin because it deprives an HIV positive from freedom to live openly, freedom to seek treatment and enjoy life. The problem of HIV and AIDS brings to us face to face the realities to the need for a well-being and good health that brings wholeness in every aspect of human life. The intention of God was also to restore, to recreate, and recover the wholeness. This gives identity to all. Restoration was the goal of healing for God in the Bible, and that is tuned with the word shalom. The stories of the 10 lepers and their experiences also reimagines the stigma of people living with HIV and AIDS by the society today. They are made to feel ashamed, victimized, isolated, and even as being divinely punished. So in such a context, the world today is groaning in pain and calls for a message of hope. So to restore the image of God and give hope, we are called to restore people affected by HIV and AIDS by giving them beauty and fullness of life. We need to relate to a world that is infected and affected by an infection, an incurable, deadly, and stigmatized disease that also functions through social justice. Social injustice, this refers to a whole range of structural oppressions like poverty, gender oppression, racism, age-based discrimination, covering various marginalized groups, such as people living with HIV and AIDS, women, widow, children, sex workers, drug addicts, and so on. In this context, we need a healing community. The search for healing, the healing of our bodies and social relation is the key to such contexts. And that is why we can understand that healing is salvation. Now, according to the New Testament concept, we see that we can understand that through some of the examples. Like, for example, in Mark chapter 1. Mark chapter 1, 40, 42, 44. We see there about Jesus cleansing a leper, the man with leprosy, and so on. Even in Mark chapter 5, verses 25 to 34, and Luke chapter 8, verses 43 to 48, we see about the woman suffering from hemorrhage. Then another example from the Old Testament, Numbers 21, verses 4 to 9. There we see about the story where the people were beaten by the serpent, but they were asked to look at the same brazen serpent for healing. The venomous bite of the serpent today can be the HIV and AIDS. Jesus, in his healing ministry, gave not only physical healing, but restored their status in the society. The motive of Jesus behind the healing was health and wholeness. Jesus identified himself with the blind, poor, prostitute, beggars, the dejected, rejected in the society. So also it is the responsibility of the church. It is the responsibility of us today to extend cooperation and respect by befriending all these different types of people. A constructive framework for responding to HIV and AIDS is also found in 1 Corinthians chapter 12, verse 26. Paul's teaching that if one part of the body of Christ suffers, all suffer together. And this is a call to acknowledge the sickness. It portrays the believers as the body of Christ that cannot separate from the joys and pains of all its members. The concept counteracts stigma and discrimination, and this provides a powerful metaphor for compassionate communities that identify with the infected and affected people. This challenges even the church to accept its identity as an HIV positive church, a church that is inclusive in nature, that identifies and that supports people with living with HIV and AIDS rather than distancing itself. Today, the church suffers from fragmentation that are caused by various social issues such as caste, gender, sexual orientation, and so on. As a result, HIV and AIDS should not become one of the issues for the fragmentation of the church, for the fragmentation of the society. So one thing that we need to do is the church, and we must first acknowledge the need to heal ourselves, the need to heal. There should be love, hope, and compassion. And these are the things needed to heal. The church also should repent for promoting stigmatization and discrimination against people living with HIV and AIDS. Today, the church needs to be open-minded to accept with love and care. And who are the church? We are the church. So we need to be open-minded. We need to read the Bible differently. We need to address the challenges to holistic health care, providing compassion, care, and support by living in love that is grounded in true morality, living in life not seduced by the rules, living in truth that ultimately releases the imprisoned. Now, churches, as I said in the beginning, and there are many NGOs today that works on the upliftment of the people living with HIV and AIDS, but these are very few. These are very few. So we need to work together with the different NGOs, or the churches also should start our own programs in order to uplift those people living with HIV and AIDS. And every year we observe December, 1st of December as International World AIDS Day. Different programs are organized on this day, but apart from it, does the church, or do we plan any other programs or conduct more programs for them? How many times have we heard pastor or somebody preaching from the pulpit on HIV and AIDS? Or what is the budget for the marginalized or for the stigmatized people in the church? Does the church keep any budget separately in order to work for the upliftment of the marginalized group of people? How do the church participate to promote awareness on HIV and AIDS? We don't need to just sit and listen to the different lectures or the seminars that are given, or read the different articles that are published in different magazines or journals, books, but we need to work out, we need to act. Then only we will be able to count these people living with HIV and AIDS into our society, count them as one, and we can live together in order to uplift their lives, bring up into a better status. Thank you.
Okay. Shall I start?
Wanda, we cannot hear you.
Can you hear me now?
Yeah.
Okay. Okay. No, I'm just requesting friends to mute your microphone when the presentation is made, so that it will not disturb anybody. So now I give the time to Mr. Sashi Imsong.
Okay, I hope I'm clear. Am I audible?
Yeah, speak
Yeah.
little louder.
Yeah, little louder, please.
Okay, I hope I'm audible now.
Yes, yes. Yes, sir.
Okay. Thank you so much for this time, for inviting me to be a part of this leadership empowerment training program through Northeast Christian University. I'm really grateful for this opportunity, especially to Dr. Wati Longchar. I will be lecturing very briefly on the topic, on the second part, I would say, on pandemic, Christian faith, and the Bible, specifically on the topic children at risk. Now, as mentioned, as requested by the moderator, to introduce myself briefly, my name is Sashi Imsong. I am from Nagaland, from our community. I did my BD in Union Biblical Seminary, Pune, and also my MTH in missiology in UBS, Pune itself. And I have been serving here in Nepal, Kathmandu, in Everest Theological Institute as an academic dean for the past 2 years. So I'm really grateful for this opportunity. So I will move on to the lecture. My topic is children at risk. I will try to help us understand just 3 main points. Who are the children at risk? Who are the children at risk? The term children at risk, we'll try to understand this term, the children at risk. The second topic is what are the major how church and Christian response to children at risk, especially from the context of the pandemic, from the COVID-19 pandemic that we are facing. I will try to bring out, since I am a missionary here in Nepal, I will try to bring out examples or try to explain from the context of Nepal, from my own experience here as a missionary in Nepal. And now going to the first topic, we will try to understand who are the children at risk. The term children at risk. Now, the term children at risk, for the past decades, you can say there has been no concrete or agreed definition on children at risk. There has been a general agreement definition that children below the age of 18 and who are vulnerable to violence, to abuse, to social discrimination, marginalized by the power, who are left out of the power structure, economic structure, can come under children at risk. However, there has been disagreement to this definition also because of the question, who are at risk? Some scholars argue that all children are at risk. All children, every children below the age of 18 can come under children at risk, and it is very true. We cannot disagree with it. But if we look into it, we can see there are degrees and levels where we can categorize children at risk. For example, some scholars say that some children are more at the higher risk than other children. For example, children who are born physically disabled or had met accidents through which they became disabled, children who are in poverty, children who are born in the Dalit people group. So all these children, or a female child is more at risk than other children. So scholars categorize according to the level of risk that children are. Now, scholars also try to understand the term children at risk by asking the question, who is at risk? This is very important, who is at risk? And they try to categorize into three groups. The first is the child itself. Who is at risk? They say the child, the adolescent, or the children below the age of 18 is at risk. And they are the ones that should come under this category. Now, even in this category, scholars differentiate. For example, a 3-year-old baby who is under malnutrition, who does not have the basic requirement that is needed. A 3-year-old baby is at a much risk than an adolescent. Let's say a 15-year-old boy who is addicted, let's say, to pornography. You see, both children are at risk, but the 3-year-old baby who is under malnutrition is more at risk and in need. Another understanding of children at risk by some scholars is they try to understand children at risk with children in need. Patrick MacDonald, in his book, Reaching Children in Need, he says, there are children who are more at risk than others. For example, children who are homeless, orphans, abandoned, hungry, neglected are children who are more in need than children who are safe at home. So children who have parents who are at home are at a lesser risk than children who are homeless. So these are some of the approaches that people use to categorize or to understand the term children at risk. Now, one of the definitions that is generally accepted or even used is definition given by the Lawson, a community of evangelism. We all know about the Lawson. Now, here, one of the definitions given by in Lawson occasional paper titled Mission with Children at Risk. Here, children at risk is defined as person under 18 who experience an intense or chronic risk factor or a combination of risk factor in personal, environmental, and or relational domains that prevent them from pursuing and fulfilling their God-given potential. So this is one of the definitions given by Lawson, where children, it not only depends on their personal, but the environment they live in, the family environment, the school environment, the social environment they live in, also put them at risk. Now, some scholars do argue that not all children are at risk, that inherently everyone is at risk. Every child is vulnerable, definitely, they agree to it, but not all children are at risk. They are vulnerable, but not all children are at risk. Now, this group of people, they categorize children who are not at risk by saying, if a healthy child is vulnerable, but the family, the parents, the people surrounding the child meets the needs of the child, meets the vulnerable need of the child, then that child cannot be categorized under children at risk. So that is one of the conditions that some scholars used to categorize children who are not at risk. Now I will try to bring out some major factors that contribute to children at risk. Some major factors that contribute to children at risk. There are many factors, but I will emphasize only on 5 factors. And I will try to explain or bring out examples from the context of Nepal. Now, first is the economic factor. Second is the social factor. Third is the religious. Fourth, political. And fifth, educational. Now, the first factor, economic factor. Poverty. Poverty is considered as the most consistent risk factor that puts a child at risk, especially extreme poverty. Now, children living in extreme poverty usually is under, you can say, less than $1.9 per day. That means in India, it will come under less than 40 rupees, around less than 40 rupees. And in Nepal, it will come less than 50 or 55 rupees per day if the income of the parents. And these children who are in extreme poverty, below the poverty line, are said to be at the highest risk and most vulnerable to be under violence or abuses from family or individuals or even from society. So additional 1 million children have now come under this multi-dimensional poverty because of the pandemic. 150 more children have been added, and 356 million children all around the world live in extreme poverty. And these adults are also affected by poverty. But the UNICEF, they say that children are more than twice affected by poverty than adults. Now, if you look, children from the poorest household die at twice the rate of their better off peers. That means children who live in poverty have twice the rate to die than children who are in a better economic status. Now, the UNICEF Executive Director, Henry Faux, he says that the scale and depth of financial hardship among families threatens to roll back years of progress in reducing child poverty and leave children deprived of essential service. Without concerned action, family barely getting by could be pushed into poverty, and the poorest family could face levels of deprivation that have not been seen for decades. Now, COVID-19 has set back the decades of work that many organizations and even the UN have been working on for the development of children. And this is one of the issues that they are facing. Not only that, the UNICEF has mentioned that the children at risk are at twofold impact due to the global economic crisis caused by COVID-19 pandemic. The first impact that the children face is because of the low income of the family due to the pandemic. The children are not able to provide the necessity requirements such as food and shelter, and even healthcare or education. And due to this impact, the second impact is affected on children, and that is because of the low income in the family, there is an increased risk in children of child marriage, violence, whether it is domestic or from outside of the family, exploitation and abuse of children, sexual exploitation and abuses, and even abuse from child laborers. So there is an increase in the factor due to the decrease in the income in the family. Now, before the pandemic, the UN states that 2/3 of the children worldwide did not have access to social protection. And because of this, after the pandemic, it has affected the children even more. And there is a cycle, there is a generational cycle of poverty that could take place for decades and for generations because of the economic effect of the pandemic. Now, some of the economic factors here in Nepal, in the context of Nepal, what are some of the factors that are affecting children from the context of Nepal? One is poverty. Poverty is one of the main issues here in Nepal. And that is why you will see many children, because of this, many parents, especially the fathers, goes abroad to work in the southeastern countries such as Dubai, Qatar, India, or even Southeast Asian countries. And because of this, it affects the family. Another is unemployment. There was unemployment problem in Nepal, and after the pandemic, many parents who were working abroad had to return back to Nepal because of the pandemic. Companies were closed, jobs were taken out, and they had to return back, and this increased the problem of unemployment. And though the parents returned, they still remain unemployed because most of the parents that go abroad to work are from the marginalized or are from the poor families. Third aspect is injustice. Injustice is due to the government are not able to implement proper care or the economic need for the children. For example, issue of child labor, issue of violence against children, or child protection, proper laws or programs for child protection is not implemented. This leads to injustice against children. Fourth is corruption. Just like India, corruption is another factor that Nepal faces. And due to this, the finance that were supposed to go for the benefit of the children, especially children who are vulnerable, is not reached. And corruption in the government office or especially in the government offices has become one of the major factors, economic factors that has increased the vulnerability of children from the marginalized society. Second factor that contribute is the social factor. Here, I will be focusing on two aspects. One is child marriage and the other is caste system, especially in Hinduism. Now, child marriage. Children who are given, especially the girls, the female childs who are given as brides to more elderly grooms and male, they are more vulnerable. And some of the aspects are education. It affects the education as they have to drop out from school, early pregnancy, and also many a times they suffer domestic violence, especially when the asked dowry by the in-laws are not met by the bride families. This results in increased or more vulnerability to domestic violence. In South Asia, statistics show that over 50% of women between the age of 20 and 24 are married as a child. According to UNICEF, in 2015, 2 in every 5 girls are getting married before the age of 18. That means 2 girls out of every 5 girls are getting married before the age of 18. So here we can see, especially in South Asia, there is an increase of child marriages in the society. Another factor is caste system. Now, caste system, only in recent decades, you will see, I will explain this more when I talk about education in Nepal. Education, only in recent decades, education in Nepal is available to all caste and ethnic groups, to all people group. But during the Ranas, which was from 1846 to 1951, almost 400 years, the education system especially was controlled by when they grew up, they were the ones who took up, who had the opportunity and the position to take up the jobs for governance over the lower caste people, because the education was available to the elite children. That is why the children, when they become adult, they got the privilege to take the position of governance, especially during the Rana period. Thus, the lack of education for the low caste period, especially during the Rana period, also resulted in the lack of opportunity for the lower caste people in the public life and administration. Now, religious factor. The third factor is religious factor. Now, in Nepal, in south of Nepal, which is also we call it as Tarai region. In Tarai region, the Muslim population, most of the Muslim population live in the Tarai region. And often, the Muslim population are neglected by the government. Often, and whether it is public policies or development or education, the Muslim populace are also often neglected. Not only the Muslim mass or the Muslim people, but also the traditional religious people. That means the tribal religious group of people who live in the Tarai region are also neglected. These people, they worship religion, and they usually live in the villages, in the rural areas, especially in the Terai region, and often among the districts or among the region in Nepal, the Terai region south is often neglected. And often in this region, the Muslims and also the tribal people, the animistic religion communities, they are the ones living in these regions. Fourth aspect that I want to share is the political factor. Here, 62% of South Asia children under the age of 5 are registered and have a birth certificate. Only 62%. And often because of this, they are not registered when they are born. They face different challenges and they are not able to access the different facilities, the policies, and the protection of the government. Now, some of the political factors that have contributed to the vulnerability of children at risk in Nepal. One is the Meyu movement from 1996 to 2005. Now, for decades, this was a conflict which affected all areas in Nepal. And one of the main factors was not only the killing of the Nepali civilians, almost more than 12,000 Nepalese civilians were killed, but it also resulted in displacement of thousands of people and families in Nepal during this period. And when the families were displaced, especially the people who are living in the poverty, it really affected them. Not only the present, but for generation it affected, because they had to be displaced from their homes. Second political factor is after the rule of the monarchy, which was abolished on 8 May 2008, there have been no stable government in Nepal. And due to which we can see that the policies, the programs implemented by the government, it keeps on changing. The new government, they will propose their own new policies, and the policies or the social protection, the fiscal policies for the children or for the families are not able to implement properly. So because of the constant change in government, that is one of the challenges, political factor that Nepal faces, and it affects especially the children. Fifth factor is education factor. Now, prior to 1951, as I have mentioned, okay, the education system was specially controlled by the Rana rule. And in 1951, we see that there were only 300 college graduates in whole of Nepal, and only 2% of the population was literate, and less than 1% of school-age children were enrolled in school, and there were very less trained professional teachers to educate children. Okay. However, okay, there is positive, there is an increase in education. If we look from 1971 to 2011, we will see there has been an increase, a sharp increase of literacy in Nepal from 14% in 1971 to 66% in 2011. And highest literacy we will see is in Kathmandu district. The lowest is in Rutahat, that is 42%. And the overall literacy rate among 15 to 24-year-old, formal and non-formal, has increased from 79 in 2005 to 87% in 2010. And thus we can see that there has been an increase in literacy and education by the Nepal government. However, there are issues and challenges. One is providing education, good education system to all groups of people. That is one of the challenges which they are facing, especially to different, as I mentioned, the Terai region, which is often neglected in terms of government policy, development, and education. Also, we will see in terms of caste, ethnicity, and gender. For example, if we look at the enrollment rate, NER, we will see that 87% of literacy or education, good education is often provided to the rich or the people who are in stable economic status, whereas the poor, especially girls, are included, who comes from the group of Dalits, caste, and other lower ethnic group are often neglected. So one of the main challenges is equal distribution of good education to all people group. Now, education here, education after COVID-19. Now, report from UNICEF in the context of Nepal. Here we see that the education sector in Nepal already faced numerous challenges, such as poor quality of education, inequity in access due to social exclusion, disability, and geographical barriers. Another issue is, as schools are closed due to the COVID-19 and classes move online, it puts thousands of children, usually the poorest, excluded and in rural areas without access to internet or with poor connectivity at huge disadvantage, further exacerbating the digital divide. Now, from the context of Nepal, some of the concern issues for children and risks identified by UNICEF in Nepal are child marriage, child labor, access to good education, child trafficking, violent discipline, violence against women, especially girls, unnecessary placement of children in orphanage, residential care homes, correction homes. Now, according to UNICEF, there has been progress by Nepal government we see past years there has been less child bride in child marriages. Another progress is their reporting to police on case of violence against women and girls has increased. Third is cases of trafficking are increasingly being intercepted. Fourth, progress is law and policies are more protective of children. They have revised many laws and policies which protect children. Fifth is specialized unit in justice sector are in place. That means they have organized special units that specially look after children in terms of justice. And six is data on children. That means especially on poverty, abuses, or sexual violence. Data are increasingly available for children at risk. However, according to UNICEF, there are still many issues that needs to be solved, especially in Nepal. One is the pace. That means child marriages have definitely been checked, but still, according to statistics, 2 in every 5 girls are getting married before the age of 18. Second is almost every child between the age of 1 and 14 suffer violence in their own home. Another issue and challenge faced is child labor has not abated. That means 1 in every 3 children aged 5 to 17 in Nepal are engaged in labor, and almost all of them are working under hazardous condition. One example is children that are working in brick factories. Here, another statistics show that around 25,000 children are living in residential care institutions. That means they are either orphans, or most of the children, even though they have parents, are kept in orphanage or residential care for children. Because parents, or one of the factors is many of the parents think that keeping in such institutional care will benefit the children. But many at times, many of the institutional or residential care are not equipped enough to give proper education and development care to children. Another aspect is violence against a report of violence against children against women have increased. But however, the number of cases of violence against children report are still very much below average. That means many of the violence against children are not reported. Another aspect challenge is Nepal continues to be a major source and a major hub and a destination for human trafficking. Especially in spite of the government, they have taken up steps, but still human trafficking remains a major issue in Nepal. Now I will go to church and Christian response. In these issues, how can the church and Christian response to children at risk, especially in this pandemic? One of the response is children are made in the image of God. In the image of God, that means children are not to be merely the object of human compassion, but they are to be object of God's love. That means we need to have a higher view of children. Many a times we do not look children as images of God or as humans who can participate in the kingdom of God. And one of the questions that I want to ask is, can children participate in the kingdom of God? Can children participate in the mission of God, in the salvation mission of God? This is one question that we need to ask. Another second response that I want to emphasize is Christians should stand for the people of the margin, which is very important. Christians should be the first to initiate against injustice, against inequality, abuse, and violence against children, especially against children, against the marginalized. The churches here in Nepal also should challenge when injustice or we see abuses or violence against children. And Christians here in Nepal, the churches and Christians are sensitive, I can say are very sensitive. The pastors, the full-time ministers, the evangelists, and even the missionaries in this generation, in this decade, have become a cause of children at risk. Third response is church must influence the government in policy making. This is a huge challenge, especially from the context of Nepal. In Nepal, there are Christian political parties. There are Christian political parties. Before 2000, before the new constitution came, I think it was around 2015, one of the Christian political party even won a seat in the government. But however, in this government, the Christian political party have not won any seat. However, in spite of being minority, the church must emphasize not simply participating in political election, but must go beyond, must try to influence in policy making, which is a huge challenge, especially for the Nepali churches and Christians, because they are a minority. Fourth response here is the family is key. The family is foundational. Here, one thing I want to emphasize here is the churches, whenever they develop or propose different programs that are targeted for children, especially children at risk, they should not only direct to educate or direct towards the children, but even to the families, even to the parents. And when we make the parents conscious or aware, we will see that it would affect the children, their development, and also help them come out of their vulnerability. Another aspect is the importance of the husband and wife role in bringing sustainability to families. Fifth response is theological discourse in the mind of the church, and our theology should go beyond basic systematic theology and find the social location of the people. That means the church ministers or the church leaders and the ministers should go beyond simply biblical interpretation or simply go beyond giving basic teaching to the people, but must engage in the social need and the context of the people. For example, in Nepal churches and Nepal theological institution here, we have the Nepal Theological Forum, NTF. I'm sure many of the Nepali pastors here and the students will know about it. So NTF is one such platform where different theological issues and discourses are discussed. And recently, just today itself, we were able to launch one book, which we were able to launch just today, where different papers were presented by different theologians, pastors, and ministers from outside of Nepal and also within Nepal. So that is one platform we need to encourage. Sixth response is the church can identify families and children that are most vulnerable to the affected of COVID-19 pandemic and see to their needs. Another response is the emphasis on Sunday school, especially the Sunday school facilitators and teachers to keep in touch with the children and where again of in conclusion, it is a huge challenge, especially for the Nepali churches and Christians, especially during this pandemic, because many of the churches in Nepal are independent. Many of the churches in Nepal are home churches, where the congregation are not from the elite or from the high class or from the high class who have good economic status and background, but many of the congregation are from the below poverty line. And because of the pandemic, many of the pastors are not even able to get their salaries apart from the well-established churches. So most of the churches and pastors are not only able to have their church services, their devotional services, but they are not able to even reach out to their congregation. And here, forget about the adult congregation, even the children are even further marginalized. Many of the pastors, they themselves are struggling financially, and they themselves are not able to even make up calls or call up or keep in touch, especially during this pandemic with the congregation. And that is why, even though many a times we propose different programs, responses, and approaches, it is very difficult to implement, especially in the context of Nepal. Churches who are struggling financially. So it is a huge challenge, especially from the context of Nepal. So with this, I want to end my lecture.
Okay. Another very clear and good presentation from Mr. Sashi Imsong. We thank him very much. Both the presenters have given us a biblical, church and Christian response to the issues that they are dealing with tonight. So in order to save the time, I would open the floor now. There are so many questions already lined up in the chat box. I request and invite the presenters to open the chat box and probably see the question to both of you. Maybe let me go first to the question that are addressed to Miss Amongla. Some of you have already, written here whether the question is for Mr. Sashi or Miss Among. So let us first go to the question number 1 from Biswa Ranjan Mohanty. Let's see, 1 minute.
Yeah.
Can you please, Amongla, can you please go
Yes.
to?
Yeah, there are some questions there. The first one is, what is the time period from HIV to AIDS? And when I will be detected as an AIDS patient if I come in contact with an HIV and AIDS patient today? Well, I'm not a medical doctor, so I may not be able to say more on that. Just a little, I think Dr. Manoj will be able to say more clearly about that. Now, I think there are 3 levels here.
So you can keep time to Manoj to respond. No, so
Yes.
Yeah, the time period. Can you hear me?
Yes, I can hear you. Yeah.
Yeah, actually HIV is a human is a virus, but it can take up to 2 to 15 years to infect a person to an patient, AIDS patient. It can take up to, depends on the different persons like immunity, the genetics, and the age group, and that can take up to 2 to 15 years to develop an HIV to complete AIDS. HIV AIDS is a acquired immune deficiency syndrome, and HIV is the virus which brings the condition, suppresses the immune system, and brings it to the condition of AIDS.
Okay.
Thank you, Dr. Manoj. Yeah, is it? Yeah, I'm Biswaranjan here. Dr. Manoj, is it the incubation period what we are talking about?
No, incubation period is, what happens is that it takes, like, if you have a hit by, you know that you are hit by an HIV, especially if you work in a healthcare field, we have like incubation period is like it takes 72 hours to few months even to infect. No, full blown infection. But like this is an incubation period, goes up to 6 months, and that is the case. There are 2 things, antigen and antibody. When you go to a laboratory and you ask them to help get a HIV test, so what they do is the antibody. Antibody is the response of infection, the virus, response of the virus infection, and against that infection the antibody is produced. But actually, if you go into as a medical healthcare worker, or even if like you get a needle prick or something, their time is 72 hours to get the prevention from the infection. So we have this, we call it a antigen test. In the beginning is the antigen, is the RNA test that is very costly. And some of the national laboratories, which are like very famous, maybe in your areas also, they do RNA test in the very beginning. The question is, how will you know that most of the time this, how will you know that a person can know I have a HIV infection? So mostly the HIV infection is detected only a person is sick, or mostly when we in India goes to a standard hospital with a routine like prenatal, antenatal treatment, operation, any kind of like severe infection. So they also check the HIV. So a lot of HIV is checked, and especially at the time of blood donation. So then on some of the people, even they never know that they have HIV. And but when they are tested, they come to know that they are tested. So especially if you want to work for the HIV, you have to like the taxi drivers, the sex workers, and and especially the drug addicts. So especially the social NGOs, excuse me, they do a drive of mass testing. Then they come to know who is infected and who is not infected.
Okay, thank you, Dr. Manoj. Probably we will go to another question by Solomon Rongpi. What should the church do after the COVID-19 is over for the people living with HIV and AIDS? This is also for Ms. Amongla.
Yes. Yeah. Thank you for the question. What should the church do after COVID-19 is over for people living with HIV and AIDS? And I'm sure many of the churches, even before the COVID, also must maybe doing many works in order to uplift the people living with HIV and AIDS. Now, after this COVID-19, yes, during the COVID-19 pandemic, the people living with HIV and AIDS, they find it very difficult because in many ways, even they're taking treatment, that there is a break even in the treatment also, because when many of the hospitals become quarantine centers and COVID centers, they don't get a proper treatment. So now after the COVID, the church, I think the church should assist in fighting against HIV and AIDS by spreading awareness to their members. And then the church should give care and support by sponsoring the treatment of the HIV patients, because with these COVID-19 experiences, they may not have enough to go for even for treatment also. So in that kind of situation, I think the church should be open. The church should come out and then try to help the people who are living with HIV and AIDS by sponsoring them through giving treatments. And then education, giving education to the people for responsible living. And then the churches also can make different kinds of strategies for prevention, care, and giving support to the people living with HIV and AIDS. Also, the church also should recognize the relation between HIV and AIDS and poverty. And then, as I said in the beginning also, they should try to relate between HIV and AIDS, poverty, and advocate measures for sustainable development of those people living with HIV and AIDS.
Yeah.
Okay.
Excuse me, madam, can I say one thing? Like,
yes, sir. Yes, sir.
Yes.
Yeah, because this WHO has already made a department with the central ministry, and every city have a CMO, Chief Medical Officer, appointed by the government, and they have already the funds for even if you have a small hospital, you want to check the HIV test, government gives the subsidy. So maybe church, if all the churches get together, form a NGO, contact the government that they want to, they give the subsidy. this comes from the Gates Foundation. And then like, even for the, if you find out that this is the HIV patient and they go for the CD4, CD8 counts and the antiretroviral therapy, all the medicine has been granted by the government itself.
Okay,
So
thank you.
you said about sponsoring. There is not much need of sponsoring. Only the need is church itself has to be aware what are the government healthcare policies in their area and how they are benefiting the people. A lot of people don't get benefit from the government because they are not aware of what government is giving. And the problem is with the Indian government, they only preach about, they only teach about this thing, election campaigns, but the basic policies are never come in the picture on your TV screen or something like that. But there is a subsidy.
Okay,
Yes.
thank you, Dr.
Thank you.
Manoj, for that information. There's another very important question here that comes both from Neiwang Form and NECU 2020. Very important question. Is HIV and AIDS a judgment from God or a punishment?
In my
This is
understanding, yeah, I think in my understanding, HIV and AIDS cannot be understood as a judgment from God.
Yeah, many people associated HIV and AIDS with, punishment from God. I think we should have a very, we should have a theology that will correct that. Anyway, there is another question. Kavi Holy, how do we encourage and comfort the HIV patients through sermon and during home visit? This is also for Ms. Among, I think.
Yes. Thank you.
And can you take also the other one? How can the church respond for the HIV patients? I think it's almost related.
That is I think how can the church respond for those HIV patients? I think that that is already taken together with the question that has been asked by Dr. Solomon Rongpi.
Yes.
Yeah. So in regard to Kavinoli's question, how do we encourage and comfort the HIV patients through sermon and during home visits? Now, we should not be judgmental. The first thing is we should not be judgmental, but then they have committed a sin and that is why they are suffering with this kind of sickness. No, we should not take a kind of judgment like that. But then we need to have a compassion. We need to have care, and then we need to speak to them with love, with care and support. And then on the other hand, we should be able to give them not only of course we will not be able to give them physical healing, but then we should be able to give them a spiritual and physical psychological healing in the process of our talking to them through the examples of how Jesus has used as model in healing people. So these kind of models can be used, and then we can talk to them and encourage them, counsel them in times of the sickness that they are going through.
Okay, there's one more question for.
In addition to what Among
Yes, sir.
has said, I think just being there with people who are undergoing a lot of psychological, physical trauma, just being there that you love them, you care for them, you are in solidarity with them, that itself is the healing. If you have a very judgmental attitude, then that aggravates more sickness. So make them experience that you love them, you care for them. I think that is the healing. Thank you.
So there's one more question for Ms. Amongla, and then we'll switch to Mr. Sashi. It's from Biswa Ranjan Mohanty. How do you justify when a child in the mother's womb is HIV positive, as a mother is HIV positive? Ms.
Can you
Amongla, are you clear with the question?
Can the question be explained?
Yeah, the question is not clear.
Yes, the question is not very clear.
Yes, Visaranjan here. If the child in a mother's womb, if he or she is positive, just because her mother is positive with a child, it is not the fault of the child. Or after the birth, it has been found that the child is with the HIV positive due to as the mother is HIV positive. How do we justify that?
We cannot blame the child because the fault is not in the child. The child is innocent. Just because the mother had HIV, just the mother had the disease and that is transmitted to the child. So we cannot blame the child. It is not the fault of the child.
Okay.
But it has been seen that but it has been seen that in the society, after some that the child is being responsible for that. It has been people. There is a common people used to curse the child that it is your fault for which you must have done something wrong in your previous life. And this is the what is there in the society, how the people deals with these people.
We need to come out from that kind of stigma and discrimination.
Yeah.
We need to come out from that, and then we need to accept that child because it is not the fault of the child. So we need to educate the people in relation to that.
Yes.
We cannot just discriminate and stigmatize the child.
Yeah. Yes.
So that is our responsibility to educate our church members, to educate the elders in treating this child.
Thank you.
Okay, now we will switch to question for Mr. Sashi Imsong. It is from Dr. Wati, I guessed. How large is Muslim community in Nepal? What are the major discriminations Muslim children experience? It's for Mr. Sashi, please.
Oh, okay, thank you so much for the question. Now, the Muslim population is also among the minority. Some say 4%.
Can you check your internet, please? I think we.
Am I audible?
We can't hear you.
I think your internet is weak.
Oh, okay. It looks all right here. What about now? Can you hear me?
Yeah, now we can hear you.
Okay. Let me answer the question from the beginning. The Muslim population in Nepal, from the total population, is around 4 to 4.4%. So the Muslim population also comes under minority. But if we look in the south of Nepal, that is the Terai region, from the total population of Nepal, about 97% of the Muslim population, they live in the Terai region. So you can see from the total population, 97 population is a huge population rate that lives in the south of Nepal. Now, concerning the second question, what are the major discrimination Muslim children experience? Now, as I mentioned, the children are especially affected indirectly. Why? Because the Terai region is one of the regions where there is a lack of development. There is lack of government policies. due to which education system, children benefactor, different beneficiaries for children are not able to implement, because many a times it is neglected by the government. And due to this, the children are indirectly affected.
Okay, thank you. There's another question. How churches in Nepal respond to children at risk, maybe? How the church can influence the government and policy making if the Christian are minority in a country?
Okay, well, let me answer the first one. How the churches in Nepal can involve. One of the main factor is to theologically equip and train the Nepali ministers, the pastors, or the full-time workers in the church. That is very important. Nepal church is the fastest growing church in Southeast Asia, according to statistics. If you look at it, Nepal, the churches in Nepal is the fastest growing. But although it is the fastest growing, there are different issues. One of the issue is the Christians, many of the Christians and even the ministers, the pastors are not well theologically trained. So many of them do not have proper theological knowledge and training, due to which their interpretation or whatever interpretation come from the outside, they go according to, we can say, how the wind blows. According to where the wind blows, they often go to that direction, because their theological foundation is not strong. And because of this, you will see Nepal, many of the churches in Nepal struggle with division. You will see many churches in Nepal are divided. There is division among congregation, among the leaders, church leaders in Nepal, and due to which we will see even the well-established churches, there are division and church break happens a lot. So emphasis on train and equipping the Nepali ministers is very important. Second emphasis I would like to emphasize is on family. One of the neglected aspects in society is a family. We can see this from the divorce rate. Nepal has a very high divorce rate, and there are different factors that contribute. And because of this high divorce rate, children are the ones who are most affected. And the factors can be unemployment problem. Many of the, especially the parent, either both the parent or the father, they go outside of Nepal to work. And because of this, single parents, especially the mother, they are not able to well develop the children, look after the children, and look for the necessity, basic needs of the children. That is one challenge which the church needs to emphasize on. Another aspect, there are many, but just the last aspect, since there's no time, I would like to emphasize is the understanding of mission. Especially, Nepal is one such which focuses a lot of mission. And here, mission here should not only be evangelism. Mission should not only be focused on evangelism, but mission should be transformative. Transformative in a sense that it should reach out to all aspects of life, not only spiritual, not only in terms of faith perspective, but also economic, social, political. That means all aspects, holistic it should be. So the understanding and the practical implication of mission should also change. And I can say many of the theologians and pastors, due to different seminars, as I mentioned, NTF, Nepal Theological Forum, they come and discuss. The pastors, ministers, many of the churches are becoming aware of this. Now, for the second question, in terms of political, I've already mentioned that Christians are a minority, and it is a huge challenge. It is very difficult for me here to give a specific, implication that to participate, but there is definitely a need, because the voice of Christians in political decision making is very less. There is almost no voice because we are a minority, and it is my challenge also, and the Nepalese churches, Christians, and ministers. It is a challenge for us. How do we voice out the Christian voice out, especially in the political decision making, in the politics? So there is one challenge which right now I cannot also give a proper implication or answer to it, but it remains a challenge for Christians here in Nepal.
Okay, there's another question from Amongla Jamir to Mr. Sashi Imsong. I invite Mr. Sashi to look into that question. It's about responsible parents. If parents are irresponsible, what should be the role of churches for such children at risk?
Okay, I would like to answer this from one of my experience. When I was doing my BD, my Bachelor of Divinity, BD in UBS Pune, I attended Naga Fellowship. So Naga Fellowship, Naga Christian Fellowship, NCF Pune, had one of the most effective Sunday school system, I would say, all over India. So it was very effective. And there were many children whose parents never came to the church, but these parents would come and send their children. They would come and drop their children to this Sunday school. And many a times I've seen testimonies from Sunday school teacher that these children, they accept Christ at a very young age, And then these children, after accepting Christ, these children are the one who impacts the parents, and the parents slowly begins to come even to the devotional churches. So through the children, it impacted the parents. So for especially in terms when we're talking about children, we can see that the Sunday school system or the Sunday school also plays a very important role. Another aspect is to identify, especially for the evangelist in the church or for the pastor, to identify the parents who are not attending or not involved in any kind of corporate worship or community worship, and the pastor can reach out and emphasize on home evangelism. So home evangelism is very important, and this I say because I have experienced this from Dimapur. I am from Dimapur Ao Baptist Church. It is one of the largest churches and established church in Nagaland, and almost there are 2,000 families, not congregation, 2,000 families, and our church have implemented, given emphasis on home evangelism to reach out, especially to families through this program, to reach out to families, to youths who does not attend churches among the Ao community. So they have appointed home evangelists. They have also appointed youth evangelists who will focus on youths and parents that do not participate in the corporate church.
Thank you, Mr. Sashi. We have another 12 minutes and the floor is still open. If any one of you can ask questions, maybe one or two more questions.
There is one more in the chat box.
Where is that?
How far is the children department growing in Nepali churches?
Okay, yes, this is a question from Chaimi Shimre to Mr. Sashi. How far is the children department growing in Nepali churches? Sorry.
This cannot be answered in general because, as I mentioned, the Nepali churches varies in different categories. Some churches, like the Ganeshwar Church, are very well established. The Koinina churches, which are very well established churches, and they have very good children department or children ministry to reach out to the children or to give biblical teaching to the children. However, most of the churches in Nepal are independent churches, are small independent churches. And many of the churches you will see, there will be many mission reports, that will mention, they have mentioned 20, 30 churches and all this. But most of these churches are home churches. Even I myself, I go and minister to one of the home churches. We are just around 20 people, especially youths, just 20 congregation in a home church. And even we have a child Sunday school department. But because of the pandemic, we, for more than 1.5 years, we are not able to have any kind of Sunday school program. Why? Because there are so many challenges. First is financial. We are just a home church, and many of our congregation itself are struggling financially. Second aspect is that many of the children that we were giving, that were attending the Sunday school, their parents are not Christians. Their parents were Hindus. So it is difficult to reach out to them. Third aspect is many of the parents, being a Hindu, are from very poor background. They are from daily workers, daily wage earners, and due to which they do not have the money to even recharge so that their children can attend through online Sunday school, or they don't have the proper mobile or technology. So it becomes very difficult and a challenge, especially for small churches and home churches here in Nepal. And most of the churches here in Nepal comes under this category. So it varies according to the church. Some churches are very established, but majority of the churches are struggling because most of the Christians are from the marginalized society, people group. I hope I was able to answer that.
Thank you very much.
One question.
One more last question, just one more, please. We have 8 minutes to go.
No, one question you left out, what method are more useful in care ministry to HIV and AIDS patients?
Oh, I'm sorry. Maybe
Lalbi from Myanmar.
Sorry, I missed that. Yes, this is for Miss Among. What method are more useful in care ministry to HIV and AIDS patient victims of HIV and AIDS? Miss Among, are you there?
Yes.
Did you see the question, Among?
Yeah.
Okay.
What methods are more useful in care ministry to HIV and AIDS? I would suggest love, showing compassion to them. That should be the first one in order to be in order to care for people living with HIV and AIDS. We need to show support to them, that they are not alone, and then we need to accept them. Until and unless we accept them, we cannot show them our care and our support. So we need to accept them, we need to be with them, and we should consider them just as we are. Then only that should be our first method to show our care and concern to the HIV and AIDS, to the people living with HIV and AIDS. Acceptance is very important.
Okay, I think we are, anything? Somebody's saying something?
Yeah, just I'm Biswaranjan. Just I'm adding to Dr. Manoj what he has told, because in AIDS and HIV patient, now the government is giving free medications and also their travel expenses. Many things government is giving. And as a church, we should know what government is providing so that we can help the patient. In COVID also, as I am in Cuttack, Odisha, so we became a bridge between the government and the patient. Because here testing is they are giving the free testing, also admission is free, everything. But many people in our church, they don't know. So as a church leader, we need to know all these things so that we can help others. Government is providing many things, and as a church, we should know about it as leaders, and we should come forward to help the people and become a bridge between the patient and the government, those who need our help.
Okay. Thank you very much. I think we should wind up here. We have just 5 minutes. And if there's no more question from anyone, we have 2 or 3 minutes to go. Then we will conclude.
Can I make an announcement?
Okay, sure, sir.
Yeah, tomorrow, same time, we will have class on the same link, same passcode. So please come on time, 6:30. Thank you.
Okay, to end this program, I would like to thank all the participants, each and every one of you, especially those who have asked questions, and for the presenters for the beautiful, insightful presentation. I hoped and pray that Ms. Among and Mr. Sashi will be able to make more contribution in the future. And there are so many things that we have learned and unlearned at the same time. So I hope we had a very good time, and let us go from here. We'll open our hearts and our mind and look into all the issues that we have talked about and learn to implement what we have learned, so that we will all contribute towards building a community of hope, of healing, of justice, of peace, everywhere we go. So I hope we can stop here, and before we disperse, shall we look to God in prayer once again? Let us pray. Almighty God, we thank you for this wonderful hours that you have given to us. We thank you for the presentations, for the questions, for the response. And oh Lord, we thank you because we know that we need you. We need you to help us to understand. And to a large extent, we understand that injustices towards those who are living with HIV and AIDS, and those and children at risk, have been fueled by our ignorance, by our fear, by our judgmental attitude, insensitivity, and lack of empathy. Forgive us, Lord, and help us to go away from here with all the knowledge and wisdom and resources to go back to our family, to our society, and to our church, and make them an ideal situation to assist these vulnerable communities, so that our church and our members of the church may become a force for transformation, bringing healing and hope and justice and peace to all infected with and affected by HIV and AIDS, including those vulnerable children, children with disability, children living in extreme poverty, children with low self-esteem, children who are abused, violated, abandoned, all orphans who are wandering around, having no place to live, safe home and shelter. We ask that you protect them and care for them, that you defend them and keep them safe. And as we disperse, O God, we pray that the love of God will be with us, will guide us, will be a signpost for us wherever we go, so that we'll be an agent of change and bring transformation to our family, to our society, and to our church. We ask all these in the name of our Lord and Savior Jesus Christ. Amen.
Amen.
Thank you very much.
Amen.
Thank you, all of
Thank
you.
you.